Yes.
Hi, my name is Justin Danhof. I represent the National Center for Public Policy Research and my colleague at the National Center, Amy Ridenauer, who's a shareholder. Last month, as you know, the U.S. Supreme Court heard oral arguments in King versus Burwell. This is a case that could potentially alter the landscape of the American healthcare system and provide an opportunity for true market-oriented reforms. As written, the Affordable Care Act was intended to force the states to set up health insurance exchanges. Many chose not to do so. Contrary to the rule of law, the Obama administration patched this gap with a regulatory fix so that individuals in states without exchanges could purchase insurance on the federal exchange and receive taxpayer-provided subsidies. Humana fully backed this potentially unlawful regulatory action. In an amicus brief, America's Health Insurance Plans, AHIP, one of Humana's primary trade associations, argued that ObamaCare's current structure is the only way for the American healthcare system to proceed, and that the ACA's, quote, tax credits and the shared responsibility payments are essential components of a sustainable private market for insurance. That simply isn't true. The court is expected to decide the King case in June, and if the justices rule for the plaintiffs, there will be ample opportunity for policymakers and legislators to correct the market-distorting effects and unpopular provisions of Obamacare. The AHIP legal brief admits as much, as it predicts a decision for the plaintiffs will cause Obamacare to break down, quote, over a period of several years. Despite the ACA having just turned 5 years old, the President has consistently and unilaterally delayed the implementation of many of the law's key provisions. Humana and AHIP stand at a precipice. You have a unique opportunity to help fix our healthcare system in a way that Obamacare obviously cannot and has not. The question is whether you're willing to be bold and do the right thing. According to your own website, Obamacare, quote, falls short in addressing the underlying cause of our healthcare crisis, rising costs. I have with me right here over a dozen healthcare reform plans that are fully fleshed out, that seriously address rising healthcare costs and offer free market alternatives to Obamacare's heavy-handed regulatory approach. I would like to give a copy of each of these to the board members here today. These comprehensive plans have provisions for pre-existing conditions, tax treatments, and also offer Medicare and Medicaid fixes. So I have a two-part question with that being said. With the opportunity to unravel the extremely unpopular Obamacare law that, in your own words, fails to address the root of America's healthcare problems, why did Humana choose to support Obamacare's current structure in the King case? And if the plaintiffs prevail in that case, would you be willing to consider working with conservative and free market leaders to enact market-based, patient-centric solutions such as those outlined in the plans I'm going to present with you today?
Well, I think at Humana we have one fundamental belief, and that is that individuals have the right to receive health care. And we as an organization are supporting that in multiple different ways. I think as you look at our where we have our businesses, Medicare Advantage, Part D, are two great examples of that. We have stated on many occasions that any law, existing or even future laws, are not perfect. And I think some of the details around the existing specific plan exchanges need to have some changes. We are always look for input from various different organizations to do that. We provide our input, and we continue to want to make it better. And so our goal is to improve it, and improve it in a way that continues to improve choice, affordability, and access to care.
Thank you.
Any other questions?